Session coming to you live from our communication center. My name is Manga Libita and I'll be your moderator this morning. The topic to be discussed this morning is social mobilization and community engagement. With me this morning is our Honorable Deputy Director, Dr. Esther Muinyangwe. I also have Ms. Petra Ipinge from our regional health region officer, but also part of the social mobilization and community engagement pillar. We are also joined by Ms. Sergeant Katrina Nomboha from City Police. Now, before we start with our discussion, our daily dose, and I'll ask our Honorable Minister, Dr. Muinyangwe, just to give us an update on the situation of COVID-19 as we stand today.
Thank you very much, Madam Manga. Good morning, everyone. And let me just correct you that I'm not the Deputy Director. They might get angry if I'm taking the position of someone. Okay, of course, the topic is on social mobilization, but just a brief update. Which still remains the same as yesterday. We don't have new confirmed cases, and for us as a ministry, that we consider that as good news. We are happy for that. And so we have the 6 who have recovered and the 10 that are still in isolation facilities. And they are asymptomatic, they don't show any signs, and they are clinically also doing very well. And as we have promised as a ministry that we will roll out the testing, we have started that since yesterday, and our team have started with those in quarantine facilities, and by yesterday they have done 116 testing, and I want to assure that the team that is usually here at the Media Center, we will do that also within the course of this week. So be ready that you would be done in this week when we also do the testing here. So that is basically the update for today, because we really don't have new developments.
Thank you so much, Deputy Minister of Health and Social Services, Dr. Muinyangwe. Now, you hear that we are also going to be tested one of these good days. An announcement will be made, so prepare yourself for quarantine should one of us be positive. Now, let's start with our discussion for this morning. Social mobilization and community engagement. Any of the panelists, what is that and why is it important in a pandemic like this?
Okay, community engagement or social mobilization. This is an involvement of communities when it comes to one willing to create awareness and sharing information so that you rescue the nation. As we are talking of COVID-19, of course, is only when people understand the disease, the facts about the disease, and they know what is expected of them, that they will adhere or try also to demand change. It's all about behavioral change through awareness. So that's why we have this subcommittee on social mobilization. It's just one among the pillars as a response to COVID-19 pandemic.
Thank you, Petra. And Dr. Muinyangwe, what is being communicated when we talk of social mobilization, community engagement? What is being communicated?
All right, thank you very much. But maybe before I answer that question, I also just want to add to what is social mobilization and community engagement. It is really a dynamic process where different stakeholders collaborate in order to bring about change in the behaviors of our community members. And now we know that COVID-19, no one, no country, no community was prepared for this. And hence, there is a need to mobilize the communities, to raise awareness, because through awareness raising, you are educating communities. So, and that is bringing me to the question of what is being communicated about, or what is it that we want to bring to the attention of communities. It's very important because, as I stated, that COVID-19 is something new. We don't know about it. We don't know the facts about it. So it's an enemy that we have now in our communities. And it's important to engage and mobilize communities in order for communities to fight this enemy, which is a common enemy, is affecting everyone from all walks of life. And therefore, what we want to bring about, or what we communicate, we want to tell people about what are the signs and symptoms, what are the modes of transmission, and how can we prevent that. That is very important. Because, you know, people have been saying anxiety is being created, people are terrified, and that is because they don't have knowledge. So we say that knowledge is power. So when we empower, because one purpose of social mobilization and community engagement is to empower our communities. So when we give them facts and we educate them about what are the signs, what are the symptoms, people are becoming empowered because they are now knowledgeable and they know. So we also communicate, like what I have just done, the daily update on COVID-19 in Namibia. It's important for the Namibians to know what is the current status. And we have been saying that we have so many fake information. So this center is the right place to give fact-based information to our communities so that they can know what is really happening around COVID-19 in Namibia. We also want to unpack the lockdown measures. It's very important. And I'm very, very concerned and worried because you still see people moving up and down. And that is not the purpose of the lockdown. The purpose is to minimize the movements of people. You go to areas like Havana, those informal settlement, people are still moving up and down, and we really want to plead that it's important, and that is part of engaging the community for them to start realizing, because people don't realize the power of social distancing, and that is one of the things that we want to tell them, that stay home, please. Even if we are saying people are not working, they are working from home, it's not a holiday. It's not a holiday. So people should stay home. That is one thing that we want to communicate. We also want to inform people about self-isolation, quarantine. What is isolation? What is self-isolation? I know now that South Africa, for example, wants to move away from self-isolation because people are also not really adhering to that one. So maybe there would also be a time for us to come there. So when you are in self-isolation, what does it mean? It means you are not engaging with other people, but you are keeping to yourself. But if it is not working, we might also be forced to reconsider that one as well. So this is what we want to communicate to our communities.
Thank you so much. And maybe let's just explain further, how do you ensure that all people are reached with COVID-19 messages? All people, all Namibians.
Mm-hmm. Okay, of course, there are so many different tools that can be applied or that can be employed to ensure that the message is reaching everyone out there. It's even reaching people in the far remote areas of our country. So of course we are talking about the television, and we know that the television is for selected few also, because people who are living in a informal settlement, is not everyone having a television, but that is one mode of sending the message out there. But the radios, that is very, very effective. And I should say that we appreciate the work that our radio presenters are really doing, because the good thing about the radios is that we have all different languages spoken in Namibia. We have radios for that, and that is important because people can be in their remote areas and they can still listen to the radio in their own language. That makes it easy for people to understand. So that is one powerful media. Then we have the social media, of course, especially for the young people, because nowadays young people are so, like 24/7 on the social media. And then facilitated health information sessions. This is, and that as at the beginning we said, is social mobilization and community engagement is a collaborative process. So you have your community members, you have your community leaders, you have your traditional leaders. Everyone should be on board to further spread the information on COVID-19. And of course we have our dedicated website on COVID-19, the Ministry of Health and Social Services website, and the center, as I have mentioned. And then we have our popular 0800 100 100 free toll line that people can also, call to get information. So these are some of the various, and I know that the Ministry of Information was also busy drafting a booklet in all the different languages that can also be distributed in various communities for people to understand what is COVID-19, what are the signs, and what is being expected from them.
Thank you so much. Sergeant Namboha,
Perhaps in addition.
do you have anything to add?
Yeah, maybe in regards to community engagement, even from law enforcement side, policing cannot just be done by police alone. We have adopted modern policing, whereby community policing and problem solving has become integral in all police activities. So having that in mind, when it comes to situations like this, where we have a pandemic, a global pandemic for that matter, we definitely cannot overlook the fact that we have to make use of communities to police themselves, and also to ensure that they equip themselves with the relevant information, and at the same time also ensuring that they are updated, because at the end of the day, whatever affects, whether it's a nation, whether it's a community, it's individuals that are affected within those communities. And we really see it critical that these individuals within communities are educated and they themselves are also involved.
Ms. Ipinge, I saw you wanted to say something.
Yeah, in addition to how we ensure that everybody else out there got information on COVID-19, there are also health workers. I believe most of us knows that we do have community health workers that on daily basis go around house to house, making sure that people who have less access to media are also getting this information. So they are doing the great job because they are on the front line and they are working like troops. So they are really doing a great job, and they are sharing information to people who does not have access to media.
And on that, Ms. Ipinge, can you just inform us, the public, how do you ensure the community health workers are giving quality information out there?
Of course, during the deployment of community health workers, first of all, we ensure that everybody is trained and got the correct information on COVID-19. so that when they get to the community, they give the facts, they give the correct information. And of course, it's ongoing that we are supporting them and updating them with the latest information on COVID-19. Like my senior have alluded that COVID-19 is something new to all of us. So every time we get new information about this disease, we update our community health workers to make sure that they are sharing the correct information with the community members.
Thank you so much. For those who may not know, community health workers were formerly known as community health extension workers. We are talking of the same category. Yeah. Now, Ms. Namboka, community policing. I think, I just feel you need to say more on that. Can you unpack that? What does it entail?
Yes, community policing in itself entails the process whereby community, or rather police officers, work closely with the community members. And we have different type of communities. We have homeowners, we have business owners, we have schools, we have churches. So it's a wide range of community clusters. So in terms of community policing, it then further entails that police officers build relations with different communities as far as safety of either neighborhoods, of businesses, and of schools are concerned. So we always have to ensure that there is a link between the police and the community. There must always be information that need to be shared, whether it has to be on a specific issue of concern that is happening at that point in time. So in a nutshell, what I can say is community policing really seek to address crime issues. If I have to talk from a policing perspective, it has to address crime issues whereby you identify the underlying causes to a specific crime, and you together with the community, that specific community then come together to identify what would be the possible solutions to that problem and how can we collectively address that problem. And in itself, that means then gone are the days, like I earlier mentioned, that policing was solely the responsibility of men and women in uniform, but as it stands for now, the modern policing states that it has to be everyone's responsibility. I also earlier stated that at the end of the day, who is affected is the community, by the community, and at the end of the day, they suffer the consequence. So in this particular case, if I have to relate now to the recent pandemic, it's no exception. As police, we are still making use of that concept of community policing to ensure that we empower in terms of information sharing, and we also influence voluntary compliance to the law. So it's not a thing of forcing people to comply, but rather they themselves, they have to understand the importance thereof, and also just to understand why do we have to behave in a certain way. Why is it that this information is being conveyed? At the end of the day, it's really just for the benefit of everyone.
Thank you so much. Now, Dr. Muinyangwe?
I just want to add on, how do we ensure that our community health workers, disseminate the right, correct information? I want to mention that the ministry also have developed a community engagement toolkit. So that toolkit is guiding the community health workers on the issues that they should cover. So that is to make sure that all the community health workers are, preaching the same message. One is not saying something else and the other one is saying something different. So that toolkit is helping them to know what exactly to focus on. And as my colleague also said, it's constant, We provide them also with training for them to know, because as we said that COVID-19 is something new, so there is always new information coming up. So it's not a once-off event, it's continuous, that training that they are also getting. I just wanted to add that.
Yes, thank you so much. Now, in this era of lockdown, we talk of community engagement. How do we do that without violating the guidelines of lockdown? I don't know if it's Petra or...
Okay, I can answer that one. During the lockdown, we are requested by all means to maintain social distancing and minimize the movements. And of course, mass gatherings are also not needed. To ensure that we are still taking information where it's due, we still have our community health workers going around their communities and of course sharing the information while on social distancing. Just like we are now in this center, I can see that social distancing is being practiced and is well applied. So it's the same happening in the community. Whenever they want to conduct a session with perhaps 2-3 households members, they do make sure that they maintain social distancing. The lockdown, of course, does not require us to move a lot, but since essential workers are supposed to do what they have to do, of course, they are allowed to move as community health workers so that they can fulfill their daily task. And of course, we cannot say they should also stay home because they are essential workers. They are doing what they're supposed to do. Apart from that, ensuring that with the lockdown, the message is still reaching people who have access to media. Of course, let me at this juncture also appreciate the fact that we have some of the print media that have live streams. And of course, social media is well engaging our communities. And of course, we are ever in collaboration with the radios that we are disseminating appropriate information without us getting to those medias, but rather conduct online sessions.
Thank you so much. Let's pause here and now move to our journalists, our foot soldiers in information dissemination. Is there anyone with a question? I think we know the drill now. You come to the podium, state your name and the media house name, and then you pose your question. How many questions do we have? Okay, let's take, there are 3. Let's start with you, ma'am.
Hi, my name is Petra Ipinge and I'm from NMH. My question would be just regarding the communication inside the ministry. Just for example, on the 16th of April, we had a case, or we had a recovery, which was reported here in the center. Then later, for the situation report, which was sent out later that day, only 3 recoveries were on that report. So I would just like to find out, how does the communication inside the ministry work? Also, the data and the detail of the affected people. How, maybe we could just find out the steps. Let's say, just for example, we have a confirmed case in the Omaheke region. Who exactly confirms that case, and how does the information come to Windhoek? Just maybe the different steps of how the communication. Also, I understand that you have a surveillance team and a case management team. Maybe just the different responsibilities of the different teams. And my last question would be, once a patient is being diagnosed, how often do you test him after, just to be sure that he's actually, that he's recovered, just to be sure, how often do you test him after?
Is it 4 questions or 5?
Yeah, sorry, it's a bit, yeah, sorry, it's a few.
The first one I did not get, that was information within the ministry or something.
Yes, because on the 16th, here in the center, it was said that we have a 4th recovery. But then on the same day, we got the situation report where it only said 3. So I just want to know how the communication, what maybe, yeah.
Okay, first question on the communication. I'm not so sure as to who were the source of providing that information, because usually if we have new developments, it's either done by the minister, the case management team, or then by myself. So, and the 4 that we had and then 6, the 2 extra numbers came later during that day because the test was run, and during the day after the morning session, that information came. So I don't know the 3 who were the source of information on how from regions to Windhoek. That was another question. Of course, we have regional health districts, how do you call them? Districts, regional districts, health officers.
Response committee.
Yeah. So they will communicate with the right office here. So it's not everyone just picking up the phone and calling. There are lines of communication, just like in any structure. Not everyone can just stand up and start sending information. There are communication channels, and that is what we are following. We have our team in the regions, and they will, whatever information needs to come to the attention of the ministry, they will send it through the right channels. Then there was
the surveillance and the case management team, just the responsibilities of the 2 different.
The case management team is the clinical team. These are the doctors and the nurses, the health workers who are dealing on a daily basis with the COVID-19 cases, the treatment thereof, and the monitoring and so on. While the surveillance team, it's more to do with the contact tracing. You know, they have to see who was the other people who were in contact with a confirmed case, because that is important for us to trace these people so that they can also, you know, be quarantined, and we observe them and monitor whether they will show any signs of the COVID-19 or not.
All right, sorry, and the last question was, how often do you just test them after?
Okay,
yeah,
yeah.
Just to be sure that they are.
Okay. I think, I'm not sure, but I'm talking under correction, and I think it's every 7 days, just to make sure, because even in the case where someone is testing now negative, they will do a retest to make sure that that test is coming out negative. So it's like on a regular basis, and I think when I was listening to Dr. Kandetu, he once said that every 7 days they do the retesting to make sure.
Thank you.
And maybe just to add on that, I've been informed that the case management team will be with us tomorrow 16 hours, so I'm sure they will answer more questions on that. There was another. Okay.
Morning panelists. I'm Dwight Links from the Namibian. I've just got a question for the Sergeant. Sergeant, there's a huge occurrence of people exercising these days, jogging about, cycling, walking. In terms of a quote that the Police Commissioner made in the past days, that people need a letter if they want to go exercise. Can you provide any clarity on that? Because it has been an upsurge of this activity during the quarantine or the lockdown.
Can I just answer, or is there any other question?
No, it's done.
Okay. Maybe let me start by saying that is one of the challenges that we are currently facing as law enforcement. Yes, the regulation has to be enforced. That has to do with restriction of movement of persons and goods, but in this particular case of persons, and only people that are providing critical services or going to obtain critical or essential goods are supposed to move, and wherein it also entails that then people that are doing physical exercise, it's also make provision for that. However, there are conditions that are attached to that. What I can say is when you are to exercise, you're supposed to do that within your neighborhood, or rather within your home environment. advisably within 1 kilometer radius from where you are residing. It does not have to be, I'm residing in Khomasdal and go and carry out my physical exercises in Auersblick. That is totally out of control. It was not supposed to be like that. At the same time, physical exercise is also rather accepted if such persons do not exceed 3 persons per grouping. Yes, I must really admit and acknowledge that groupings, when it comes to physical exercise, has really become a challenge. And I just want to believe and also to encourage that if we are really to exercise, the aforementioned measures are supposed to be strictly observed. The number of persons and also the place at which the exercise is supposed to take place. I don't really want to touch on the medical permit, due to some reasons, because yes, I believe if you are to exercise and you adhere to these procedures and of course, most importantly, observing the social distancing, then I think we will not have a problem at all.
Good morning, my name is Selima from NBC. My first question is to the sergeant. I just wanted to find out, you mentioned that you have built relations with community members, and in terms of giving out information on COVID-19, I didn't quite get what you guys are doing to communicate with the relations that you have built with community members. If you can perhaps just briefly go into that again. I also wanted to find out, one of the issues that people in rural areas and also in informal settlement are having is that they are finding it hard to stay at home because they do not have food to eat at home, for example. I mean, what are some of the things that are being done when it comes to community engagement to let the people stay at home and also find other means of getting resources, for example? We know that in Windhoek, for example, we have companies that are donating food items to community members, and now that the lockdown is extended to other regions, what are the engagements in terms of getting, items for community members, especially those that don't have food at home? Thank you.
Thank you very much for the question. Maybe to touch on the first one that has to do with community relations. Yes, like I mentioned, we have a number of different communities ranging now from business community, neighborhoods and schools. So what I can say is or rather the platforms that we make use of mostly is meetings. But for now, meetings are totally suspended. But then we also make use of our radio platforms, and or rather radio platforms that we have available in the country in different languages. And we also engage our communities here in terms of WhatsApps and emails. So at this point in time, yes, I must admit that the only way really that we can get down to the community is through the WhatsApp platforms. Of course, when the officers are on patrol, are also talking to the individuals on the streets, because we are always on patrol and we cover the whole of Windhoek. And also the other things that we make use of is through our neighborhood watch groups that we have, because we have contact persons whom we normally make use of. We centralize information to that person and then they take it down to the community, but of course not in terms of meetings, but through mostly the WhatsApp groups that are available. I think we can move on to the second question. Yeah, let me also just start by saying that when it comes to movement of persons who claim to go obtain essential goods or service, it also has become a challenge for us. I must tell you that almost every third public transport that you stop, there will be somebody or people with an empty container of medicine, claiming that they are going to acquire medication from the pharmacy or from the hospital. That is the current trend as we speak. So it means that every person is trying to make any possible excuse to make sure that they are out of the house. We know it's very frustrating to be confined in one place, but coming up with excuses like that, it's really supposed to be a no-go area. Yes, we have monitored, and at times where possible, where we have resources, we escort these persons where they claim that they are going to either obtain medical attention or medication, but it was to no avail. So it's really a challenge, and therefore our position remains that if only people could voluntarily comply with the laws, then we really will not have a problem. And I think people also need to understand that when you go out there, you are actually increasing the risk, your risk of contracting the disease, not necessarily giving headache to the law makers or to the law enforcers. That is one aspect also that people need to understand. I think she has to come back with a third question.
Okay. There were only 2 questions. So there you have it, Namibians. My fellow Namibians, let's not get smart in breaking the lockdown guidelines. It's for our own good, no one else. It's for your own health, the nation, and everyone else. Are there any other questions? Yes, sir. Please move to the... Is there anyone else? Okay, this will be our last question.
Good morning, everybody. My name is Samuel. The question that I have here, I know it's a little bit hard for everybody actually, or for the law enforcement officers to sort of control the movement. And there were some allegations that apparently for taxis to move, there must be passengers inside the car. Maybe just explain how this work, or how will this work effectively if we are saying that there must be passengers in the car for the taxis to move. I mean, normally they drive around hoping to pick up somebody, or especially the people that are into those that have to go to work but they don't have their own transport. Maybe just explain how will this work effectively. Thank you.
Got the question?
Yes, thank you very much, Samuel. Yes, what I can say is when it comes to the regulation of transportation of persons, it's also provided for in the state of emergency COVID-19 regulations, whereby it states that in a car that has the capacity of a 4-seater, for instance, a taxi now in this case, a driver is only supposed to carry 3 passengers, if I can put it that way, which means 4 persons per car, which now includes the driver. That is strictly what the regulation is saying. So in terms of what can they do then, what is supposed to happen is, really things has become business unusual. You are not, as a taxi driver, supposed to go to a taxi rank and wait for customers no longer. You have to make arrangements, but what we can say is only to advise that you must have people that either made a call that you need to pick them up, either to go to a shop or to go to the pharmacy or to the doctor. You have to have a list, or rather you have to engage a number of people that you have to work with to transport. It's not for you as a driver to go out there, drive an empty car to go look for customers. It has become business unusual. So unfortunately, it does not have to be that way, but rather a taxi is only supposed to move when they either receive a call, like I earlier mentioned, or a request that they have to transport somebody, but only for obtaining of essential services, not for visiting purposes.
There we have it. Taxis only to move when they have passengers or they have been called to pick somebody. For now, I just wanted one last question before we come to the final words. Maybe Petra, you would handle this. Do we have any printed materials in place, and in which languages? And where can one get them?
Yeah, when it comes to printed pamphlets, of course, we do have very few, and they are distributed as they become available. This is an ongoing process. We keep on printing. At the same time, the moment they become available, they reach the community. So if you want to have some printed material, you may visit our IEC division at the head office, Ministry of Health. You get what you want to know about COVID-19. Apart from the the pamphlets at IEC division. You may also visit our regional office, that is Commerce Health Directorate. We have a few pamphlets on how to take care of your colleagues being at the workplace. Then you know how to prepare your facility in terms of COVID-19 prevention. So feel welcome to come and visit our regional health directorate and have few.
And do we have some in Braille?
Some?
Braille for the visually impaired?
Unfortunately not, but I believe it should be in a pipeline. Our IEC division is very committed to make sure that each and everybody gets the information on COVID-19. It's the only way to do.
Thank you so much. Now, last final words. Let's start with Petra and move over to our Deputy Minister. Last words.
Yeah, my final words to fellow Namibians is that let us practice good hygiene. Is the only way we can prevent COVID-19 transmission. And when we talk of good hygiene, we are always preaching that let us wash our hands with running water and soap. In the absence of that, then you switch on to sanitizing your hands. We need also to adhere to the lockdown measures, including social distancing. We know it's very frustrating, but it's the way to go so that we cut off the transmission of this disease. When it comes to COVID-19, of course, we know this virus does not move, it does not fly, it does not have legs. It waits for us people to move it. So the moment you lessen your movement, you already cut off the spread of this disease. Let us stay home. We are on board for you, and you'll meet the government or the Ministry of Health halfway when you stay home, because then you cut off the spread of this disease. And let me also urge for those who have information on COVID-19, let us not be selfish. Let us take care of one another. Let us share information, and let us make sure that everybody know what is expected of them when it comes to preventative measure or precautionary measures of COVID-19. I thank you.
Okay. Sergeant Nambongo.
Thank you for the opportunity once again. My final remarks would be that desperate times calls for desperate measures. So this is a time when we need to work together. This is a time when we really need cooperation from members of public. If it says confinement restriction, it means confinement to your home or confinement to your zone. As we know, the country is divided into zones. So please do not be a chance taker. We are mandated to enforce the law, and surely the contraveners will have to face the consequences. And also maybe just to finally conclude by saying, but let us by all means avoid sharing fake news. Thank you so much.
Honorable Deputy Minister.
All right, thank you very much. You know, we are saying that social mobilization, community engagement is about public awareness. It's about raising or educating our communities. It's about, most importantly, to help our communities to change our behavior. That is the most important thing. Because at the moment, we are in a, let me say, abnormal situation where things are not as usual. And that is why it is so important for communities, for people, for individuals, for groups to change their behavior. And we can only change our behavior if we are sensitized. And for me, the issue of educating, creating awareness should not stop. It's ongoing. It's not something that we only do during the lockdown time, But you know, we have a state of emergency for 6 months or so. So we should continue doing that, because it's the only way how we can win with this pandemic. And we need community members, community leaders. We need church leaders to also get involved in helping, sensitizing communities and in informing them and emphasize why it is important for people to stay home. And I will keep on repeating that one, because it looks like it's not going into the ears of our Namibians out there. People should stay home. It's the only way how we can fight the pandemic, the COVID-19. So lastly, I would like to say that, of course, changing behavior goes with what is in our minds. So, and to change, a paradigm shifting is not something that happens overnight. And that is why we have to be like the priest and continue preaching for people to understand where we are telling them that they should observe social distancing, they should wash their hands with water and soap, and why we are saying people should stay home. Because when we stay home, it's the only way how we can save the lives of the Namibians. I thank you.
Thank you so much. There we have it, fellow Namibians. Just a friendly reminder. Some wars don't need for all of us to be in the front line. We can do it in the comfort of our homes. Stay at home, stay safe. In case you have any health-related concerns, especially those relating to COVID-19, please call our toll-free number, 0800 100 100. And then I also wanted to just announce something, or remind, as you may have received this, as of today is 20th, right? The regional councillors or constituencies are no longer issuing travel permits. Maybe I should repeat that. The regional councillors or constituencies are no longer issuing travel permits. They are now being issued by NAMPO regional commanders and the authorized station commanders, regional health directors, and regional directors of education. Should you wish to travel, please contact the authorized officials. Thank you so much and have a lovely day.
In itself entails the process whereby community, or rather police officers, work closely with the community members, and we have different type of communities. We have homeowners, we have business owners, we have schools, we have churches, so it's a wide range of community clusters. So in terms of community policing, it then further entails that police officers build relations with different communities as far as safety of either neighborhoods, of businesses, and of schools are concerned. So we always have to ensure that there is a link between the police and the community. There must always be information that need to be shared, whether it has to be on a specific issue of concern that is happening at that point in time. So in a nutshell, what I can say is community policing really seek to address crime issues. If I have to talk from a policing perspective, it has to address crime issues whereby you identify the underlying causes to a specific crime, and you together with the community, that specific community, then come together to identify what would be the possible solutions to that problem and how can we collectively address that problem. And in itself, that means then gone are the days, like I earlier mentioned, that policing was solely the responsibility of men and women in uniform. But as it stands for now, the modern policing states that it has to be everyone's responsibility. I also earlier stated that at the end of the day, who is affected is the community, by their community, and at the end of the day, they suffer the consequence. So in this particular case, if I have to relate now to the recent pandemic, it's no exception. As police, we are still making use of that concept of community policing to ensure that we empower in terms of information sharing, and we also influence voluntary compliance to the law. So it's not a thing of forcing people to comply, but rather they themselves, they have to understand the importance thereof, and also just to understand why do we have to behave in a certain way. Why is it that this information is being conveyed? At the end of the day, it's really just for the benefit of everyone.
Thank you so much. Now, Dr. Muinyangwe?
I just want to add on, how do we ensure that our community health workers disseminate the right, correct information? I want to mention that the ministry also have developed a community engagement toolkit. So that toolkit is guiding.
All right, so what we did find out today is that the ministry is going out, just communicating with the people, telling them, informing them what is going on, always keeping social distancing, of course. They are also printing pamphlets in all different languages, just so everybody does know what is going on and is informed. We also found out that the jogging should further not be any problem. If you do, remember to only be 3 people. Also, do keep social distancing while running. And as Ms. Chikwambi said, please let us not spread any fake news anymore. Thank you.
One take live.